We'll be starting in a couple of minutes. Good afternoon, everyone. We're going to get started. My name is Patricia Correa. I'm the Manager of Information, Services, and Translation here at the Christopher and Dana Reeve Foundation. I wanted to give you a couple of housekeeping points. This webinar will be recorded and sent out via email to all registrants, as well as available to the Reeve Foundation in our YouTube channel. If you have any questions, please make sure to put them on the question and comment box at the bottom of your banner. Live captioning and American Sign Language interpretation are available today. Please also take the post-event survey to help us continue to bring valuable education webinars to you. As I said, I am working with the Reeve Foundation, and we are very happy to introduce you to this webinar today. I am going to introduce you to Sara Tribe Clark, Director of Eldercare, Locator, and Disability Information and Access.
All right, thanks so much. My name is Sara Tribe Clark, and I am a middle-age-ish woman. I have white skin. I have brownish, almost blondish hair, depending on the lighting and the time of year. I've got on some brown glasses and turquoise square earrings and a gray top. So thank you very much for that introduction. I'm going to be sharing my slides in just a moment. But I just want to thank everyone for being on. And I'm really interested, before I switch over to the slides and I can still see the chat, I'd love to get a sense from you. I know there's a lot of people on, but I am going to ask a question that I'm hoping to look through the chat and see. I'm interested to know where you're from, who's on the call. So sometimes I do presentations for people who use services, sometimes for family members, caregivers, professionals. So I'm interested to get a sense, you know, in a 1 to 5 words, who you are and where you're calling from. And I'm just going to take some time on the chat before I start sharing where I can see. Right. And some people are really good multitaskers, but I have trouble switching between chat and presentation. So Patricia said she would help me keep an eye on the chat as we go through the presentation while I'm presenting anyway. All right. Right. I see long-term care ombudsman. Hi, Linda. And I know I can't acknowledge each person. There's so many people on, but all right. Oh, I see ADRCs. All right. I worked in the DC ADRC for about 5 years. So that certainly resonates with me just before coming to US Aging. Right. I hope others are looking too, because this is a great, varied and very experienced group. All right. Great to see you all. And thank you for being on. Representation from all over the country as well. That's great. All right. Well, as I present, I will be mentioning, you know, people who are using services as well as professionals, because I see there's quite a mix. And please, again, I know Patricia said it, but if you do have questions, feel free to post them. I did receive a bunch of questions in advance. There was an opportunity for questions at the point of registration. So we'll be going through all the questions. My presentation, I think, might be about 30 minutes or so. So we'll have plenty of time for questions. And also feel free to pause me, Patricia, if it seems like there's a question that's really pertinent to the resource that I'm talking about. Feel free to jump in. All right. So is it okay for me to go ahead and screen share?
Yes, you can go ahead, Sarah.
Right. Can you see my screen all right? All righty. So, as I said, so we'll be, you know who I am now. Today I'll be making sure you have 2 critical resources in your personal tool belt or your professional tool belt that can help you connect older adults and people with disabilities to resources that they need in any state or territory of the United States. So just a word on US Aging. We represent and support the National Network of Area Agencies on Aging and advocates for the Title VI Native American Aging programs that help older adults and people with disabilities live with independence, dignity, and optimal health and well-being in their homes and communities. And we are the 2 national resource centers we'll be talking about today, the Eldercare Locator and the Disability Information and Access Line, or DIAL. So we're funded by the Administration for Community Living. We're administered, again, by US Aging. So we help older adults and people with disabilities, caregivers, family members, and professionals find resources they need to help people or to themselves remain as independent as possible in the community. So we'll start with the Eldercare Locator. And if you have either heard this presentation before or have been in the field for some time, you may have heard about the Eldercare Locator. The DIAL is the newer one. We started in about 2021 with DIAL. The Eldercare Locator has been in effect for over 30 years now. And so this is more the well-known name, but that doesn't mean you have to know about it. And I am interested to know, is there anyone who is brand new? This is their first time hearing about the Eldercare Locator. I am going to do a quick look at the chat. So if you're brand new, don't worry if you are, it's a good thing. But I'm interested to know from the crowd if this is the first time you're hearing about us. All right, I'm seeing a few yeses already. All right, and that's so great. We always want to spread the word for new learners, and then just refresh everyone's memory for people who've heard about us before. All right, so we are best known as a National Information and Referral Call Center. We're based in Washington, D.C. We're staffed by about 15 information and referral specialists. And when a caller from anywhere in the country, or actually internationally as well, some people call from outside of our country, but they reach the Eldercare Locator specialist by phone, live chat, email, text, or more recently, we started using for ASL, or American Sign Language, direct video conferencing. We have that now for the Eldercare Locator instead of having to use an interpreter. So if people call us in any of those ways or contact us, we have a conversation with them to figure out their unique set of needs. And then we use our database, we use our understanding of various resources and what people are asking. So we'll probe a little bit, make sure we get the full range of understanding of what they're looking for, and then we refer them to local, state, and/or national resources. So that could be area agencies on aging, our members, could be state units on aging, other national call centers. So for example, Parkinson's Foundation, our Alzheimer's Association, the Reeve Foundation, depending on what people need and are looking for. All right. So the person most likely to contact the Eldercare Locator is a person over the age of 60. About 59% of our callers, they call the locator seeking services for themselves. And I guess I have 56% in the table here. So 56% calling about themselves, and 70% report having a disability. So that's generally people over 60 calling the locator, saying they have a disability. About 50% of those individuals further describe themselves or report having a physical disability. About 25% report having chronic health conditions, and about 10% of those saying that they have some type of disability report having mental or behavioral health needs. And then we recently, for both call centers, started collecting a lot more demographic information. So we asked people to self-identify their race and ethnicity. So whatever that means to them. We hear back that 52% of callers over the last 6 months identify as white or Caucasian, about 27% as Black or African American, about 9% Hispanic or Latino, and then 2% each say that they are either Asian, Asian American, or American Indian or Alaska Native. So we do find a lot of people are, of the 50%, 52% of callers identifying as white or Caucasian. This is true for both call centers as well. Many of those folks also say that they identify as another ethnic race or ethnicity. And I'm mentioning that it's interesting to us because we're really going about letting people self-identify. So they don't have to, lock in as a particular way. They describe themselves, and then we can write in other as well. So we're really trying to make sure that we're understanding who's calling and that we're getting them the resources that they need that can be culturally appropriate, as well as needs that they have for physical needs or in-home needs. So we're really excited about the information we've been getting, the improved referrals that we have. Our quality assurance process has been getting better as well. And it's all tied in with asking questions, more questions about people and getting them to the places they need. So the slide that I'm showing now is a pie chart reflecting 6 months of call documentation to show the most frequent inquiries that Eldercare Locator receives from people with disabilities. So this isn't the full gamut of people that call, but that 70% that report having disabilities. We looked further into the data to see, and about, so 25% of people report that transportation is the purpose for their call. Some people call with multiple purposes, but at least 25% of inquiries are about transportation from older adults who report having disabilities. And then the next most frequent call type is people calling with questions about housing and housing options. Now that has grown significantly in the last couple of years, especially since COVID. Anybody working in this field or living in this country have probably noticed that housing has become much more of an issue. So we see that reflected in our data very clearly. So 24% of calls are about housing from people who report having a disability. And then other frequent call types, I'll read a few more here. About 17% are calling about in-home services. About 7%, we're still getting calls about COVID-19 testing and boosters and other related questions. About 6% calling with nutrition questions. 6% calling with questions about abuse, neglect, or exploitation of an older adult. About 5% related to legal questions. 5% related to medical services, and also long-term care questions, which could be related to nursing facilities that people are already in, but it could also be related to in-home services, long-term care, in-home services, as well as nursing facility type questions. All right, so moving right on. Not everyone wants or necessarily needs to call or live chat with an Eldercare Locator specialist, though we're always open to it. People can also use more of a self-service option on our website. So it's designed to, our call center is also designed to assist members of the public who are seeking resources or just looking for a starting point. So by going to our website, and it is here on the slide, eldercare.acl.gov. Feel free to plug that in if you're at your computer. So you can access our database, get connected to local aging and disability resources. And this is often the preferred method for professionals seeking to have a quick contact for people that they're helping. If you've kind of helped someone to a certain extent, but now you're just not sure where else to turn or need more general advice, we can go onto this website, enter the person's zip code or city and state, and pull up a range of resources that are available to anyone. Really, it's the database is associated with zip codes for everywhere in the country, US territories, District of Columbia. So you'll be able to find resources there. They may be more generalized than, what people, sometimes questions are so specific, but by getting people to more general resources, and I'll just pull up the next slide because these are the ACL funded, that's Administration for Community Living, funded resources that people can find on the Eldercare Locator website. And that's information and referral assistance. That tends to be a program within the Area Agency on Aging or Aging and Disability Resource Center. So lots of words to describe two types of organizations that are very specifically set up to assist older adults and people with disabilities to find local resources. And that information and referral program or department is the front door. That's often the starting point within a locale. Once you have the person's zip code, there is an information and referral and assistance program assisting every zip code in our country. So we can plug in and at least get a starting point. The Title VI American Indian, Alaska Native, and Native Hawaiian programs are on the website as well. State units on aging, which a lot of times might be more of, sometimes people will have complaints about like not being able to get in touch with their area agency on aging or their aging and disability resource center, or they have an advocacy need. They have an issue that they'd like to bring to a higher level than their local information and referral or area agency on aging. Elder abuse prevention, health insurance counseling. And I apologize, this keeps advancing on its own. So elder abuse prevention, health insurance counseling is, people may have heard of the SHIP or State Health Insurance Assistance Program. If not, that's programs that are associated with Medicare. Oftentimes they'll have expertise in Medicaid as well, and how other insurances might overlap. They're very knowledgeable. We even refer people to SHIPs. Sometimes during Social Security, after those COLA letters come out, the cost of living adjustment letters from Social Security, people are calling up very worried and concerned, and they may need to talk to Social Security, but they can't get through. So sometimes we overlap with the state health insurance assistance programs to help people at the local level understand or even gain access in some cases to their Social Security office. Legal services programs, and then long-term care ombudsman. I saw at least one ombudsman on the phone or on the line. So we'll refer people there if it's a long-term care related issue. For the most part, that has to do with various institutions such as nursing facilities and rehabs, but it very well in some places also maybe long-term care, in-home long-term care, like through Medicaid, etc. So I'm going to go back to the previous slide and just mention if you didn't have a chance to put it in, or maybe you did and you noticed the information, hopefully you recognize it and you're already in touch with the organizations that serve your area. If you see any mistakes, please let me know. That's the real reason I went back to this slide. We're able to update the information very quickly. Once we know, we will verify it with the various organizations, but we just want to make sure our contact info is accurate. Great. So I'm just going to quickly mention our Home for the Holidays campaign, mostly because the topic this year, we choose topics that we want to be relevant throughout the year and even ongoing. This year, we're trying to encourage older adults to volunteer. We know that since COVID, there's been, unfortunately, a huge downturn in the number of volunteers. So this brochure was created in a way to help people feel more confident about volunteering, to present different ways to volunteer. Maybe people are still wanting to do something online. Others are wanting to get back in person, maybe don't know where to start. So the brochure is really focused on helping people get back to volunteering or volunteer for the first time if needed. I mean, if they need help with the starting point. And we re-released this during Volunteer Awareness Month, or National Volunteer Month, I think it's called, in April. So we not only released this brochure in around the holidays, we try to do home for the holidays campaigns at a time when, people are most likely to all be together, between, let's say, November, December, January. We hope that people are getting together as families, maybe tackling some difficult conversations, or, I'm just going to show some of the other topics that we've covered. Living well with dementia in the community, caring across the miles, which is really focused on long distance caregiving, and then staying connected and healthy during the pandemic. So that one was just about 2 years ago. We were trying to help people get reconnected after, the pandemic was still going on, but we wanted to let people know that there's still ways of keeping connected and engaged, even though it may not be as safe as it once was. And hopefully, similar to what I was saying about the volunteer topic, as people gain more confidence, we want to help them plug in where possible, because volunteering has been so critical in the aging and disability networks. And there's been a real obvious hit to a lot of the programs. It's, if you don't have volunteers, it's very hard to run. So the way you can find more information on that is on our website, usaging.org/H4H 2022. And that'll take you to the various brochures, as well as toolkits for posting this volunteer information on social media. If you have newsletters or various, social media that you'd like to put this out in, the toolkit can help. All right. Oh, also our brochures can be co-branded. So you can put an organization's logo on the back alongside with US Aging. Right, and our contact info for the Eldercare Locator, our phone or text is 800-677-1116. And that is the same number for video phone, ASL communication. So we contract with an organization called ASL Now, and they have trained specialists that are trained and use our same documentation system, and we're able to track callers, but the same exact phone number. And I see this slide, I'm sorry, has a error. It is 800-677-11. Uh-oh, I'm so sorry. I'm going to put the correct in the chat. It is the same number as the Eldercare Locator, which is the top number, not the bottom number. My apologies, I just noticed that. And then our live chat is through our website, and then our email is eldercarelocator@usaging.org. All right, and I do want to mention as well, our hours of operation for both call centers is 8 a.m. to 9 p.m. Eastern. All right, so I am just going to pause there. I'd love to know if there's questions already in the chat, or I know we're going to have Q&A at the end, but just in case there's a very Eldercare Locator specific question.
Sarah, I think that the only thing that we had was from somebody from South Dakota that is looking for volunteers for their senior companion program through Good Sam.
Okay. So, and I'm wondering, are you interested in the volunteer related work we did around the Home for the Holidays campaign? Or are you asking something about like how you might go about that?
Perhaps we can talk about how to go about it. Hopefully that will be useful for Donella.
All right, and it's just placing this in the chat. All right, so I am going to pull up. So normally with volunteer, and here, I want to make sure I don't give incorrect information. So I'm going to pull up our Home for the Holidays site, and I can even show it. home for the holidays. Right, I'm just going to share my screen again. And this way too, I'm just trying to show a resource that we were just talking about, but one that you can also use. All right, so here is our US Aging site for Home for the Holidays. This web page was also on the slides. I know you'll all receive a copy of those. So you can find the brochure in both English and Spanish, and then the Aging Network Toolkit, which can show more information about if you want to share. So I'm just repeating that. All right, so our brochure is, let's see. So we did work in close partnership with Senior Core, which is, let's see, I want to make sure I get all the information right. Okay, so AmeriCorps Seniors. So we, and I'm not sure if the attendee who asked that question is already working with AmeriCorps Seniors, but a lot of times with our Home for the Holidays campaign, we'll partner with an organization that is very good at what our topic is about. In this case, we did partner with AmeriCorps Seniors, and their website is www.americorps, that's AmeriCorps.gov/Pathfinder. And that's actually our specialists will use that website to putting in a zip code, be able to find some recommendations. But within this brochure, we have your question is not about whether people should volunteer. It's about how to go about it, I think. So we normally, when we get that question, and if we got a question from someone seeking volunteerism in your area, we would go to that AmeriCorps resource. We would actually recommend that they try their area agency on aging, because we and area agencies are, we hope to be a pathway for volunteers, especially older adult volunteers, looking for something to be doing for volunteer work. So we recommend connecting with the AAA and then also the AmeriCorps. Those are the two avenues. I know we also have some other national resources that we might look into, and I'm happy to ask our resource team and get back to you. If you let me know your email, I can give you even more resources if you'd like. Hope that was helpful.
Thank you, Sarah. We have another question. How do we let you know if there's an error on the website?
All right. Well, you should email me, and I will share my contact information again right now. So this is on the slide as well. And I know you'll get the slides too, but so I'm STRIBE CLARK, S Tribe Clark at USAging, USAGING.org. So just email me, make sure you note in the subject line something like that you are on this webinar, and I will make sure to forward that on to our resource team. So they do make updates very quickly. Again, they verify it first, but if you are the director of your AAA or your Aging and Disability Resource Center, and we see that you are the director, we'll take your word for it. But otherwise, we want to make sure we're not changing it if the agency hasn't agreed that change is right. All right, any other questions?
I think that's about it for now.
Great. All right, well, let's move on then. We'll move on to, oops, I'm already sharing. Well, good. The Disability Information and Access Line. ACL, as I mentioned, the Administration for Community Living also funds this call center through US Aging. We administer it. So we really used our expertise with the Eldercare Locator, our understanding of National Resource Centers and how they work in the telecoms and all the things associated with them to start dial up very quickly. Within a few weeks, in fact, we hired people very quickly. I'm sure many of you during the beginning of COVID have a sense for some of the scramble that was taking place to get things moving that were remote. were tailored to people with disabilities, people with the greatest need related to COVID. And back in March of 2021, President Biden announced an additional large sum of funds would be allocated to CDC, Centers for Disease Control and Prevention, in supporting aging and disability networks. They were very specific about it. So the CDC worked closely with the Administration for Community Living to figure out ways to very quickly support the aging and disability population to be able to get information out, especially about COVID. So US Aging received supplemental funding through ACL, but in partnership, an unprecedented partnership with CDC to start up a disability call center that was going to mirror what the Eldercare Locator call center could do. So as people call in for both Dial and the Locator throughout COVID, starting in 2021, we started asking people if they needed assistance with anything related to COVID. And Dial was very much marketed, especially at first, to people with disabilities around COVID access issues and helping people, sign up for vaccinations and all the things that rolled out that were very online based, and people who maybe don't have the internet or have trouble figuring it out, that kind of thing. It was obviously a big barrier during the beginning of COVID when you couldn't even get a vaccination unless you were signing up online. So we helped walk people through that process, helped connect people with vaccine information. And in the process of startup, and to this day, we have many partners that we work with closely. Right out of the gate, we knew we had the call center piece down, but we were not experts in any way in disability work, resources, culture, how to reach people through marketing, that kind of thing. So you may recognize some of these names, some of the organizations that we worked with, but we worked with ACL, our main funder, along with CDC, to identify leaders in the disability community that could help us as we set up Dial very, very quickly. So they helped us to just make sure, as we were naming the call center, training our specialist, developing quick reference tools, advising where to refer Dial contacts when they called, making sure our database was current with all the various resources that our partners maintain, and then also promoting Dial. And similar to the Locator, we refer to local organizations. So our most frequent referral is to Centers for Independent Living and Aging and Disability Resource Centers, AAAs. Those three are at the top of the list of referral types. But we also have many other types of referrals, and we wanted to make sure that we already, through the Locator, were referring to CILs, but we weren't necessarily doing as much referring beyond that for people with disabilities. So we've really done a deeper dive into training and understanding the disability community and resources. So we work closely with, again, the organizations listed here, the Association for Programs for Rural Independent Living, or APRIL, Association of University Centers on Disabilities, or AUCD, Association of Assistive Technology Act Programs. It's noted as AT3 here, but it's ATAP is the acronym for the Association of Assistive Technology Act Programs. Independent Living Research Utilization, ILRU, the National Association of Councils on Developmental Disabilities, National Council on Independent Living, National Disability Rights Network, and the Partnership for Inclusive Disaster Strategies. So I had mentioned the demographic work and really making sure that we got our questions right, that we get our data right. These organizations have just been amazing at helping us ask things the right way, respond the right way, just making sure that the cultural competency training that we do with our specialists is on point, and that we're collecting data that's important and how we want to make sure we're tracking who we're reaching, who we're not reaching, and making sure that we're setting up a data system to be able to update our marketing work, or how we answer questions if we need to. So who is most likely to contact Dial? So We have received, let's see, more than 80,000 calls since our start back in May of 2021. About 78% of callers contacting Dial are seeking services for themselves, and about 42% are between the ages of 45 and 69 years old, and about 40% report having a physical disability. We have, let's see, I guess very similar in terms of people self-identifying race and ethnicity, very similar breakdown as I mentioned for the Locator. About half of the callers identify as white or Caucasian, about 24% identify as Black or African American, about 9% is Hispanic or Latino, and then about 2% each of either Asian, Asian American, American Indian, or Alaska or Hawaiian Native. So that's our kind of quick overview of who's contacting us. And then for people who, just have to remember the percentage. So 40% report having a physical disability, but we have more than that of people reporting disability in general to Dial. Not necessarily all the callers, but many of them. And the pie chart reflects the last 12 months of reasons people with disabilities contacted us. So that is about 57% related to Social Security. And just to note, our the Dial contact information has been placed on the COLA or cost of living adjustment letter from Social Security Administration. And that produces each year a spike in calls that is like quadruples the number of calls that we normally get. So that's part of that large percentage of calls. But the second most frequent call is about COVID-19. COVID-19 vaccines specifically, at 12%, and housing, 7%, health insurance, about 4%, and transportation, about 3%. So it's pretty different from call center to call center why people are calling. And we do also have a significantly smaller number of people so far calling the Dial center, but we're working on it and increasing that so people know about us more. All right, so in terms of why people are contacting Dial. So the most frequent reasons, and I guess we did talk about this a little bit, but I wanted to point out for COVID reasons, in-home COVID vaccination and COVID-19 booster shots and testing. So those are the two reasons, and in-home COVID vaccination has always been far and away the most frequent COVID-related question that people ask. And then COVID-19 booster shots and testing, it has reduced slightly over time, but we still get a very steady flow of calls about it. All right, so we talked about some of these others already. So I'm going to skip to the next slide. So the most frequent Dial referrals to aging or disability specific organizations, again, our Centers for Independent Living, area agencies on aging, aging and disability resource centers, and our developmental disability councils. And then just other COVID related, but not necessarily as high of a volume of referrals, are state and local health departments, vaccines.gov, state COVID lines, state health departments. We have many resources that for internal spreadsheets and things that we're always keeping updated. Even now, we're really trying to make sure we can connect people quickly to their own state health departments. We can look at their websites in real time and, give, especially now a lot more places are doing the in-home vaccinations. But for 2 straight years, we had to really keep our finger on the pulse of how people could get connected to those in-home vaccinations, because that was far and away our most frequent question. So, and we know that COVID is not necessarily something that people are still as interested in. We have been keeping in mind and marketing Dial since the beginning as also a place to find independent living resources, community living resources, knowing that hopefully COVID is not going to be as prevalent over time. We see already it's no longer classified as a public health emergency. We know COVID is still very much out there, but we don't want to, we just want to make sure people know that that's not the only thing they can call us about. We're also able to connect with independent living and community resources as well. So I'm just going to put up our marketing materials quickly, and I'm happy to put a link directly to how to get these in the chat. So we have a postcard, a magnet postcard now, that people can pull the magnet off and put it on their fridge with the dial contact information. We also have an infographic that is shown. We do always mention COVID-19 very much front and center on our marketing materials, but then also people can call, dial to help get connected to local resources related to transportation, disability rights, so those protection and advocacy programs state by state, and then also independent living resources. And just a few more, our social media toolkit. We have those along, like similar to that Home for the Holidays toolkit. We always produce a toolkit along with various campaigns that we do, making sure that it's as easy as possible to post social media articles and things like that. We had a recent dial marketing campaign in which this billboard was posted in a community, but we are happy again to share some resources with you. We are on Twitter and Facebook, and the dial webpage. So again, I'm going to post specifically to the marketing materials. So usaging.org/dial connect will take you to the dial US Aging Dial website. And then there's also some specific marketing materials that I'll send you. And I also wanted to mention, we are working with the Administration for Community Living to update the dial website so that although we have a web page right now with US Aging, and I will post that as well, but, oh wait, it's here. So for live chat, you go to acl.gov/dial, and that's how you can start, that's where you can start a live chat. There's also a button to click on ASL Now on that website. But we are just about to get an actual website, instead of a web page on acl.gov. The URL is going to be different, and I'll make sure to get that over to Patricia to be able to share, hopefully in the next few weeks, probably a month at the latest. We'll be launching a site that, like the Eldercare Locator, people can put their zip code, city and state on the dial webpage. It's a website. It's going to also be by county and state, different ways to search so that people can find their disability related ACL funded resources. So instead of a little dial page that has information in both English and Spanish, it'll be a whole dial website. So that's coming soon. And that is it for our dial slides. I'm gonna stop the share again. And I'm happy to take questions. I also have a list of questions. If we don't have more questions in the chat, I can jump over to that list.
Sarah, we can go ahead with the list.
All right. Right, so the first question that I received, so what resources are available to help an aging employee extend their employment work life? And what role can our agency play? So this is an example. There's a couple of resources that we may offer. We try to offer people, up to 3 resources, or as many as it sounds like they're writing down, So we may offer, there's a couple of resources, our resource team let me know, careeronestop.org, or let's see, Job Accommodation Network. And I can post these two in the chat. Here's one. And other. One step. So these are 2 resources. Now, I just want to also, I should have started off with this, but for each of these questions, the resource team did kind of help me respond to these with the caveat that we really prefer to talk to everybody. If there's a complicated or multifaceted question, we actually have a multi-tier system set up where we have staff that take kind of the general questions. We get people over to the usual resources that are also listed on our website and database. But then we also have a team of enhanced service specialists that if people have more complicated questions, or if they're in crisis, or if there's, just a lot of complex things going on that is not a quick referral, we escalate the call to them so that they can do a little bit of a deeper dive into the kind of the whole constellation of needs that someone is calling about. So while I just posted those 2 resources, those would be, very specific to the resource ask. So for the idea of aging employee extended their employment work life, these are 2 possible resources, but we would want to talk to the person and, get a little bit more information. We tend to give people their area agency on aging for questions about employment, because like many questions that we get, we think that the area agency or Aging and Disability Resource Center, oftentimes those are co-located and they're sharing resources. They know, their fingers are on the pulse of what's going on in the community. So we may be able to give these national resources, but there may be something right down the street from the person asking this question. Maybe you've already worked with your AAA, but a lot of times there are job employment programs. There are, federal, state, local funded things. Maybe there's volunteer programs that are a pipeline for things like this, or maybe there's support groups, or, there's things that we just wouldn't know about at the national level. So the AAA would be a potential referral in this case, as well as the others that I mentioned. And I'll just, unless I hear from Patricia or someone, I'll just keep answering these questions, okay? The next one that we got.
Sara, just really quickly, somebody needs a clarification.
Okay.
Is the name of the specialist Enhanced Service Specialist?
Yes. That's what we call our, sometimes information and referral or phone call centers will say tier 2 specialists, or, just that group of specialists that takes a longer time. Yep. Enhanced services. All right, so moving right along, what are the best telehealth options for spinal cord specific healthcare and doctors? And then the person who added, I feel most of us at this point have been doing this for a while, and we need a collaborating physician who understands spinal cord injuries. So this is a really good example of a question we would most likely refer over to the National Paralysis Resource Center. So, and I know you all are hosting this, but we would give that as one of the resources. We don't have specific knowledge that's that specific, but we would listen to the person's, constellation of needs again. We would figure out if it was an appropriate referral to their area agency on aging, where they've already worked with. We're not going to give their AAA if they've already been working with them for years and they have no more resources there. But if they haven't heard of it, there's also a chance that there may be other needs related. It may not be quite as specific as that to answer that question, but we could give national resource centers and the kind of the local ones that we normally give. I'm just looking at the chat too. Right. So I'll go on to the next one. What are some general things to expect or look out for as a paraplegic ages? My husband is 68 and was paralyzed 4 years ago. He is mostly independent. He needs assistance dressing and getting out of bed. So we approach aging as a unique process for each person. We know that there's, there's absolutely no one size fits all approach. People have a whole variety of needs. And again, when we hear in-home services, we want to connect people with their, and especially depending on age, but Center for Independent Living, especially if someone has a recent disability, because there's the Centers for Independent Living might have some advocacy or specific regional or, local assistance that we don't know about, and then transportation related, and a AAA again for in-home services, anything to do with like ADLs, so activities of daily living, we would refer over to the AAA, especially in the case where he's 68 years old. Right away, again, we would think AAA. They have case managers who will do, sit down and work with the person, as well as if they designate family members or caregivers as well, and, kind of work through the whole unique set of needs and what the resources are. A lot of times there's like a small range of free resources. In some places there's eligibility requirements. In other places it's an age requirement. And then AAAs can also help people figure out, all right, after the free resources, then what else might there be that is you have to pay for, but here are some starting places of good agencies that we know about that you can tap into. So anything else on that one? All right, how do you connect to people who do a higher level of care? I have people who are not trained for it or comfortable doing it. So this one, we weren't 100% sure of the higher level of care, but my sense is that it may not be, like maybe a AAA and what I was talking about in the previous question. There may be some more specialized care that's needed, and we wouldn't necessarily know locale to locale what there is, but we have confidence that the Area Agency on Aging will at least have some starting point. In some cases, they may have, and I don't necessarily think this question was about caregivers, like family caregivers. It was more about like a increased level of care, probably for maybe someone with a physical disability, but I'm not really sure. So again, I would say between the Area Agency and the Center for Independent Living, there's usually a starting point in there. And if people are already connected with those resources, I think that's the part where we have our enhanced services team. It's not the end all be all, but it's, they will look at some more national resources. There may be like a funding question. We may be able to work with people on benefits, for example, of getting more, signed up for more benefits. So they have more money to use to hire people for specific needs that they can train themselves, that kind of thing. But again, it's really hard to answer without all the details and kind of knowing where somebody is. All right, and I think, a lot of these questions really speak to how important it is to have time, connect with people, and understand what people are saying. So for DIAL especially, our disability network partners from the very first meeting, it was all about, you have to give people time. So a lot of times with call centers, there's this, it's very quick. They're trying to like get you to, one thing, and it's not just, we're just getting everyone to the AAA. It's really that we're trying to hear what's really going on and then figure out what might help. And it's not 100% success rate, or we always find something for people, but at least we were able to have a person listen and connect to local resources and some national resources if it makes sense to do so. All right. Let's see. How do I get an advocate for Medicare appeal of a horrible power wheelchair? All right. So I had mentioned the State Health Insurance Assistance Program, or the SHIP program. They're called different things in different states, but I'm happy to help you to figure that out. But it is in our database, the health insurance programs, legal services, or protection and advocacy. So the protection and advocacy programs in each state, they are like, this question makes me think that someone's been trying. There's a wheelchair that's not working. There's a Medicare appeal to be happening, but something's going wrong and they need advocacy. So those, the SHIP, legal services, and protection and advocacy, those are three things that we would generally recommend in if the assumptions that I made about that question are correct. And let's see. My team also sent me over a resource that is Quality Improvement Organization. And I am going to post it in the chat. Manages all complaints. Okay. Right, there's one resource to check out. But again, like I recommend maybe give us a call. You can email me. You can email me, and I can connect you with our head resource person. And she takes calls as well. She's a supervisor, Kaylee, and is very happy to dig into resources, do that deeper dive, and see how we can help. All right, and then for people in need of caregiver services, and I am very much aware that the National Paralysis Resource Center or the Reeve Foundation is very much able, willing, there to help out caregivers. But a few other caregiver services, again, through the area agencies on aging and centers for independent living, we find that there's a lot of resources in the AAAs that they put towards supporting caregivers. And sometimes it is caregiver support groups and trainings and things like that. Also, oftentimes they have some sources of respite funds where caregivers can have funds to be able to pay for respite while they go and, have a day off or something like that. So those are, but there's many other services that are offered. Those are just a few, but those are pretty much the three that we would have people start with. All right. So those are all of them. Yeah. All right. And I'm just going to check the chat again to see if there's anything that I've missed in the process.
I don't think we do. And I think we're also about running out of time, Sara.
That went by so fast.
Yeah, I know it went really fast. I wanted to thank you so much for joining us today. I think we all have learned really great resources that you highlighted. As we said at the beginning of this webinar, please remember we will be sending an email with the recording of this webinar available for you to watch when you need to. And also we ask you to please feel free to fill those post surveys. They help us to provide you with the best type of webinars as you may need. Again, thank you, everyone. Thank you, Sara. And I hope everybody has a lovely afternoon.
All right. Have a great day.